Hello, everyone. My name is Mabel Carabali. I am a Canada researcher on methods to address health inequalities, assistant professor of epidemiology in the Department of Epidemiology, Biostatistics, and Occupational Health at McGill University. Today, I'm going to talk about my lift-off project, the America's Race and Ethnicity Equity Data Hub, integrating health research and sustainable use of evidence, the ARISE project. Before talking about the ARISE project, I have to clarify two concepts, Americans region and race and ethnicity. The Americans region is composed by all the countries starting from North America, Central America, South America, and the Caribbean. 30% of the population in the Americans region self-identify as Afro-descendant and or indigenous. The Latin American region and the Caribbean are recognized as the most unequal subregions within the Americans region. Yet, comprehensive data on race and ethnicity and health inequalities is still sparse. The scarcity of this data is mainly due to inadequate data collection and the statistical invisibility of these marginalized groups and their associated inequalities. Those inequalities stem from structural issues that date centuries. Health inequalities, and especially racial and health inequalities, can be eliminated. However, without proper information on health status of racialized populations or information on the presence, where, and how, and the magnitude of the racial inequalities, the way or the goal of providing recommendations for policy making is just futile. However, this data documentation is challenging. Why? Because there is heterogeneity, not only in language. It's not just being called Black, Negro, Preto, or Noir. According to the language, it's further than that. Being Black or being considered Afro-descendant can be called different ways and different names in the same country, even within the same language. Because being Black may mean different things for different individuals at different points in time and in different contexts. This is a challenging process. Hence, my idea is to generate a data hub that concentrates all the information about race, ethnicity, and health inequalities. My idea is to collect data from openly available existing resources, including census data, vital statistics, surveillance report. Likewise, I'm aiming to use information from the published literature as well to the great literature. Why? Because all this information is very valuable, however, it is very heterogeneous. I think that having a single data hub, single data repository for data on race and ethnicity will be imperative for academic research and decision making. In the same way, for improving access to information to the general community. How is this process or how this process could be obtained? How can I get to my data hub? For that, I need to do a data creation process. The first step is the data collection and quality check. As I just mentioned, data is highly heterogeneous, not only for language, but also due to competition and because in a preliminary analysis, we observe that from 11 countries in Latin America, there are reports that exist, for instance, in census data, but are not in birth certificates or death certificates or surveillance information. So it's very information to get accurate or complete data on race and inequality. After that, with the data we have, either for published literature, for available data sources, or from the great literature, we have to create a metadata center and document all this information. Hopefully, with this information, we could proceed to harmonization of data that could be all centralized in the data hub. The step 3 or the step of governance and policy compliance is related to have all this information and creating good guidelines that allow us to know how, when, and to the extent that we can use and interpret the data that we have. Finally, I am aiming to have a self-sustainable data hub. That means using AI, machine learning, and other automated procedures that help me with the data fetching, with the metadata creation, the documentation, according to the governance and policy complaint that is self-sustainable, that can help us to monitor and keep the data. How I am aiming to use this information in terms of my outcomes and the vision that I have for this data hub is to have data that is robust, that is served or that can be used as evidence for academic research, decision makers, considerations or recommendations for mitigating health inequalities, for strengthening health system research, improving access for marginalized groups, for the general community to provide information about their rights, the resources, information that they have. I think that all these will help with accountability and will help us to foster more data, fetch more data, and improve the quality of the data that we have in the end. So far, I'm continuing with the data fetching and the quality monitoring. I am working with the data governance and monitoring for the data hub, working with academic stakeholders, working with local government agencies and grassroots organizations. As you may realize, this labor has been titanic over the last year, given the changes in the climate, given the changes in funding, and given the change in the priority research, which, as you may understand, do not include research on race and ethnicity. My goal is the data that we have in the data hub is complies with the FAIR considerations. That means it's findable, accessible, interoperable, and reusable. Again, my goal is that this data repository can be used for academic research, decision-making, and the general community. My goal is to have a beta prototype live by February or March 2026 and have a self-sustainable live data hub in the summer 2026. This is all what I have to share with you so far. If you have any questions, please do not hesitate to contact me. Thank you so much. Merci beaucoup. Muchísimas gracias.